Hi, everyone, and thanks for joining us. This is Mark, and I have Joe and Emily here with me. We want to take an opportunity to provide our partners with a few resources and considerations for adjusting to the COVID-19 crisis now and moving forward. So, real quick overview. We know that the crisis continues and will impact our organization, region, and county moving forward. So, we wanted to provide a couple of areas of potential resources, as well as introduce a couple of potential opportunities for continuing to address the needs as they emerge. And at the end, we wanted to give a quick update on kind of the BCI changes that we've been instituting. So first, the community definitely has had some emerging needs based upon the crisis. Beacon has been looking at a couple of criteria to help understand where the needs are emerging, as well as specifically what geographic areas are most impacted. So we've been looking at maps to help understand where to deploy our resources. This is true both for BCI as well as Beacon as a whole. So the first map that we're looking at looks at African American as well as Hispanic populations over the age of 60. There's been a lot of news and research that's been coming out about how this population specifically is most at risk for contracting COVID-19. So as you'll see, there's definitely some hot spots that pop up where these populations are centralized. Next, this one looks at minority household income, again, looking at the Black African American population as well as Hispanic. So you'll see that it's actually very closely mirrored, where the low income areas and hotspots are both on the west side of South Bend as well as Elkhart counties. So I think the most interesting component here is where you combine these two factors and you're able to see that while our region has about 35 census blocks in it, if we combine those factors and highlight them, we actually get to about 4 to 6 census blocks that has the highest concentration of those most at risk. We think this is really impactful to help complete outreach, but also thinking about community partners and nonprofits helping to understand what areas geographically would be best to deploy their resources to help find new or engage existing clientele. So a couple of other resources that we wanted to point out. First, there's the Urban Institute that created a map that looks at low-income jobs that are being lost. And so this specifically looks at census block information and is able to identify where major job loss communities and populations are. And so this is available nationwide. So if you're interested, you can go to their site and really drill down into the specific areas to help understand very small geographic regions that have the highest level of job loss. Another resource that is available locally was produced by the Michiana Area Council of Governments. They looked at a number of criteria and were able to create hotspots to help understand where significant high-risk populations were living. And so this is a snapshot of the report that they produced, which really helps kind of hone in on where potential issues may be. And so we think, again, this is a really powerful tool and set of information to help partners that are reaching into the community really try to understand where these at-risk individuals are living. So after we've looked at this information, you've probably been hearing about the Beacon mobile testing site. They looked at the information we just shared, as well as a plethora of other resources to really understand where they needed to be deploying. And so you've probably been hearing about a number of testing sites that have been out. This is the set from last week. And we'll be continuing to share the mobile testing sites moving forward, because this has been a really powerful way for us to be able to reach into communities that probably weren't getting tested but are very much at risk. So I'm going to hand this off to Jo now. She's going to be able to talk about the emerging needs that we've been able to identify from our conversations with our community partners.
Thanks, Mark. So as Mark was mentioning, there are a lot of emerging needs, and we've been able to identify kind of the geographies associated with these needs. But also, thanks to you guys, you've all filled out a survey probably earlier in late April, March-ish, or sorry, early April, late March. And from those surveys, we were able to kind of find these 4 areas, which were food insecurity, housing, mental health, and lack of educational resources. In addition to that, we have some additional resources we've been able to share with you guys. So we have Be Well Indiana Institute, the Indiana State Department of Health, and these mental health resources. So what I'm going to do is I'm going to take a few minutes to share some of the different collaborations that have been going on, and then Emily's going to take over and then share the different ways that you can collaborate digitally. It's really important as we look at this time to think of different ways that we can basically react to the situation going on with Corona. So you can see here that we have a chart of some of the different activities that partners have going on. It's divided up by organization name, county, resource, who it's available to, and what the cost is. And generally, you'll see a lot of these resources are free for anyone to use. The one exception is Mosaic, which has $40 for current patients and $70 for non-patients. Now, this is not a comprehensive list. If you're looking for a more comprehensive list of all the various activities that go on within our community, you can check out the resource guide, which goes along with this PowerPoint presentation. All right, so as I mentioned earlier, we're going to have to find ways to adapt to the new normal. New estimates say that some form of social distancing could be needed until 2022 or even longer. So we really need to start thinking, as I mentioned earlier, how we're going to continue to support our participants with this new version of the normal. As I mentioned, Emily will be talking about how we can connect digitally, and I'll be continuing to talk how we can do some collaborations. And there are going to be a few examples internally, and then one example of kind of external outside the state case study of what people are doing to collaborate. So why do you think it's important to build collaborations? Well, one of the first reasons is it's a good opportunity to pool resources. We've seen a lot of organizations working together where one might have had a need for something, another one had a surplus. So by being able to provide those, you can end up making a greater impact overall and reach more people. A great example of this you'll see in the next slide is with the Babe store. So basically what Kathleen Craner has been doing over the course of, well, in addition to COVID, just in general, is she has been providing resources to the community. And now that COVID-19 has become a bigger thing, she's really amped up her game. So she's been able to do a mobile unit. She's been providing diapers, wipes, and toilet paper as supplies last. The collaboration she's been working to form is with Sarah Stewart from Unity Gardens. So what Sarah Stewart is doing is she has various produce that she's been growing to deliver to the community. And since they've been kind of collaborating and staying together on calls, Sarah actually made the offer to Kathleen that she could provide lettuce and other produce that Kathleen can give out at her Babe store. This is really awesome because not only is Kathleen able to deliver some essentials, she can also address the issue of food insecurity, and it works out well for Sarah because Sarah has a broader reach of population. Another great resource is St. Joseph County Health Improvement Alliance and United Way. They've been really active throughout this whole crisis and have come up with some great collaborations. One of these collaborations is the Emergency Food Initiative, where they managed to build 40,000 frozen meals to support food banks, pantries, and schools with limited supplies. The other one is their Mobilizing Family Supports. This is a thing to address areas that aren't directly related to food insecurity, but are related to issues due to COVID-19. So that could be loss of income, domestic violence. We see a lot more of that now that people are staying at home as opposed to students going out and about, child abuse, students at home, being alone, loss of health coverage, and substance and alcohol misuse. And these kind of all line up with what we had mentioned earlier as emerging needs. As you can see, we mentioned education, housing being an issue, and mental health. So very awesome that they're doing this work. Especially with the Emergency Food Initiative, they have managed to bring some great people to the table. And the next slide, we're going to explain a little bit more of how one of these organizations was doing that. And that organization is Cultivate Culinary. So prior to the pandemic, Cultivate was probably delivering less than 1,000 meals per week for students. So they're a food rescue organization. And following the pandemic, they decided, okay, how can we really address this issue of food insecurity? So they amped up their meals, and now they're providing 3,600 meals per week. And they managed to make a great partnership with the South Bend School Corporation. In addition to this, they're still working to determine where some of these meals should go. So another partner reached out to us and was able to make that collaboration with Cultivate because they wanted to reallocate funds. And what they did was partner with Cultivate, and now they have 125 meals coming to their organization per week, and they're distributing those to neighbors in need. This is a tip for nonprofits if you guys want to get in touch with Cultivate, and you can find their contact information in the resource guide. You're going to want to make sure that you have freezer space. So the collaboration case study, and this is the last one for me. Ozark Alliance to End Homelessness, based in the state of Missouri, decided to form a collaboration, kind of this COVID-19 task force. And the collaboration was a group of 20 partners in 3 counties across the state of Missouri. Really awesome to see this kind of collaboration going on. It's such a large geography. And their whole goal was, how can they react to the issue of homelessness due to COVID, or make sure that people kind of prevent further cases. So their plan was to facilitate community education and engagement during this time, sustain existing shelters and housing options, create alternative shelter options, meet health, hunger, and hygiene needs, and prevent future episodes of homelessness. So now what I'd like to do is hand this off to Emily, who's going to talk about connecting digitally.
Thanks, Drew. With so many unknowns about how long social distancing will last, especially for the most vulnerable we serve, it's important to take this time to consider how to stay connected. This may mean doing things differently and funneling resources into digital platforms, like your website, social media, creating an electronic newsletter, or recreating a phone tree. I'm going to highlight a few things to consider when connecting digitally with participants, and highlight a few of our partners who work to invest in digital resources to stay connected. As programs consider moving some or all of their programming online, there are a couple of key questions we think it's important to think through. In most cases, programming could, in some capacity, be moved to an online format using the plethora of different platforms and programs that already exist. But just because it can be done doesn't mean it's a good idea to do so. Here are the questions BCI thought through as it transitioned some of its school programming online. First, what pieces of programming can be done digitally? Some programs, by their nature, require people to be in the same location to achieve the results they desire. However, there's the important opportunity to adjust, tweak, and splice programming to better fit into a digital format. Second, what are the potential pitfalls? Sometimes there are issues related to HIPAA. Also, there could be risks associated with providing programming without in-person support. For example, some types of counseling or therapy could create additional risks if there isn't the right type of support system in place. Third, does the population have the technology and know-how? For digital engagement, typically participants need a computer, internet, and a baseline level of knowledge. For programs that engage with lower income or older populations, this could create engagement barrier to digital connection. It may be necessary to collect additional information or offer technology trainings in the event social distancing continues, so that you're able to better connect with participants. We have included an attachment with things to consider asking participants during intake. If this is something you would like to build out further, please reach out to your Beacon Community Impact Project Specialist. Fourth, what are the operational needs to transition to digital? This is where things can get a little sticky. As we mentioned, there most likely will be modifications needed to the curriculum, which will take staff time. Identifying who will participate. Are you going after new participants or trying to re-engage with existing participants and enrolling them? If there will be new participants, what's the onboarding or intake process, and how will you capture their information? For executing the program, what technology is needed? There are a number of different platforms that could be used and have different functionalities and levels of privacy built in. Also, while there are some free versions of these platforms, there will most likely be a cost associated with them. How do you manage the staff in this case and provide them with the support, tools, and oversight needed to develop and deliver the program? These are all things to consider operationally when considering switching to digital. And finally, the fifth thing, what's the new definition of success? There's the possibility that the program has the exact same goals, objectives, and expectations for impact as before. However, most likely there will be some changes needed here. Now that we have reviewed considerations for transitioning to digital delivery, which platform should you use? Here are some tools we identified that may be useful to you to continue to connect with participants. This is by no means an exhaustive list, but just some ideas to get you started, and what we suggest are some of the pros and cons. Please remember, whatever digital platform you decide to use, be sure to check the security measures in place so you can be sure that you keep your participants' data safe. Both Zoom and WebEx have HIPAA compliant options. Only you can judge the level of security that you need for your program. Now let's look at some examples of Beacon Community Impacts partners who transitioned to digital programming. In mid-March, as it became clear that social distancing was necessary to combat the spread of COVID-19, Mental Health Awareness of Michiana began investigating digital options to present mental health topics and began to change topics for previously planned events in response to the needs of the community. They've always been focused on mental health awareness, but shifted topics digitally to cover the practice of mindfulness and self-care in direct response to what they were hearing the community needed. They followed that up with other topics related to caring for ourselves mentally and emotionally during crisis and isolation. They investigated various platforms and ended up selecting Zoom webinars so they can reach more people. They ran into a slight hitch when attendance for the April 29th Zoom webinar in Spanish was down, so they reached out to various members of the Spanish-speaking community for feedback. They heard that Facebook Live was a more attractive platform for local members of the Spanish-speaking community due to familiarity and ease of use, so they quickly transitioned to Facebook Live for that event, and the video has gotten more than 200 views so far. They also created an electronic survey link that participants can complete so they can track demographics and assess knowledge gained from the presentations. All digital presentations are free and available to the public. To see more about upcoming presentation opportunities, please visit their Facebook page at MHA Michiana. Another partner who were able to successfully invest in digital connection are Mosaic Health and Healing Arts. Mosaic operate as a clinic who are LGBTQ+ welcoming and inclusive. As you can imagine, they had additional challenges identifying which clinical services could transition to telemedicine and then navigating those waters, and which clinical services needed to remain in person and the challenges that came with that. They ended up investing in HIPAA-protected Zoom for healthcare to ensure digital security and privacy for their participants. They also chose to invest in ramping up their social media presence so that those who are feeling isolated and alone would have more opportunity to connect with Mosaic and their digital support groups. They also chose to expand their digital support groups to be more flexible on topic and timing to connect with more people. At this point, Mosaic has decided to hold off on continuing their LGBTQ+ awareness education digitally because they feel the way it's taught is way more personal and impactful in person. However, they're still considering different ways to hold this training digitally in the future. Some additional things Mosaic suggests considering when deciding which programming or parts of programming to transition digitally are: 1, think about each program individually. 2, think about how each program fits in the big picture. 3, think about what needs to be prioritized. And 4, know which details of what you do is sacred to you and why. This can be fluid. To contact Mosaic, please visit their website at mosaicHHA.org or call the office at 574-537-2680. Riverbend Cancer Services, who provide a variety of services for those impacted by cancer and their families, adapted the vast majority of in-person services into digital services. They initially tried to deliver food to participants, but found there were some safety issues that need to be considered before proceeding. They also tried to host support groups digitally, but with their participants, the counselor did not feel the group was able to connect as successfully digitally. So they're holding on those for now. They also found that although most participants were able to continue mental health counseling digitally, some participants were uncomfortable doing so, so they continued to work with them individually and find different ways to connect. Riverbend recently identified a way to deliver art supplies to their participants so they can continue art therapy sessions digitally. They continue to call to check in on a regular basis, but have shared that calling participants can be difficult to get them to answer. They've tried a variety of different wellness activities via Zoom, like yoga, Zumba, and things like that. They're responsive to feedback about the wellness activities that participants do and do not like, and then they adapt accordingly. Overall, Riverbend was able to innovate and adapt to find success connecting digitally with their participants. If you or someone you know has been impacted by cancer and are interested in learning more about the services provided by Riverbend, please contact Yolanda Gatson at 574-287-4197 or check their website for updates, www.riverbendcancerservices.org. One thing all the partners we've highlighted have in common is that they've chosen to prioritize their participants' needs and adapt operations to be more useful for them. In many cases, as you heard, that meant they have to try new things, new platforms, new topics, new processes to share and connect. Some worked and some didn't, and if they didn't work, they tweaked them and tried again, always with the participants' needs in mind. There are a lot of unknowns right now, and we're all trying to operate in an uncharted territory. Give yourself a break. Be willing to try something and scrap it if it doesn't work. Be willing to reach out to others for guidance or suggestions, whether that's other nonprofits, staff, or directly to participants. One easy way to collect ideas on ways to adapt is to create a digital suggestion box for staff, participants, or other community members to submit ideas for other ways to connect. This can be easily created for free using a Google form with a link that you can share. Beacon Community Impact do this as well, as you will see at the end of the presentation, through a feedback survey link using our survey tool, Qualtrics. Please complete the feedback survey and let us know if you found these ideas around identifying and serving the most vulnerable through collaboration and digital connection useful. If you have other suggestions on how Beacon Community Impact can further assist your organization during this time, please let us know those as well. Now I'm going to turn it back to Mark to wrap things up. Thanks.
Thanks, Joe and Emily. So most of the changes and expectations have been delivered to you already via email. However, want to do a quick recap of things that have been going on. So first, the reallocation continues to be available. We've had a handful of organizations who have taken this up on the offer, but this is definitely something that you can still take advantage of. Feel free to reach out to myself or your project specialist to let us know if you'd like to talk through that. Second, we have canceled the mid-year survey as it currently stood, and we're going to, in its place, put something we're calling the COVID transition survey. We've scheduled this to tentatively take place on July 1st. However, this is definitely up for change based upon the pace of the reopening. The copy of the questions have been included in a previous email. However, if you have any questions, just let us know, and we'll definitely keep you updated as much as we can as we get closer to that date to make sure that that date still holds. Third, we are still planning on holding the end of year survey to help understand what the impact has been made over the past year. However, please know that we are thinking through what the options are in terms of funding extensions and changing of reporting requirements and what funding for next year will look like. So we will be in communication as quickly as we can as soon as we hear about what decisions have been made. And finally, I want to make sure to emphasize that the outcomes team is still working and we're available to support our partners in whatever way that we can. So this can be both in terms of a COVID response, as well as with any general program development projects that you may still have going on. So please feel free to reach out at any point to either Joe or Emily, and we are more than happy to take on any projects that might be helpful. So in closing, we want to make sure that you found this helpful, but also want to collect any additional ideas or workshops that you might find helpful. And so in the email, we've included a link to the feedback survey. So please go on and fill that out. And we'd be really happy to continue doing things like this if you find them helpful and for topics that would help continue to serve the community. So appreciate you listening all the way through. And again, look forward to engaging with you in the future. Thanks.